Hi, everybody. I'm Natalie Block, a primary care physician at Mount Auburn Hospital.
I am Abby Friedrich. I am a nurse practitioner student at the MGH Institute of Health Professions.
And I'm Michael Palazzolo. I'm a pre-medical student at the Harvard Extension School.
And I want to tell you a story about Anne. During the last year of her life, when she was 83 years old, Anne visited about every 4 to 6 weeks my practice with her daughter to take care of her breathing and swollen legs. Despite the frequent visits, she was hospitalized about 7 times that year. But Anne actually didn't mind the frequent hospital stays. She liked it. And the reason is that she had hallucinations of puppies and kittens staying with her in her room each time she was in the hospital. It was an amazing way to deal with these painful situations. My goal was to keep her comfortable and outside of the hospital as much as possible. I realized how difficult it is to identify that moment that indicates the beginning of the end. We plan so many things in our life. We plan our birthday parties, our weddings, how many kids we want, sometimes even their names. Shouldn't we plan also the final days of our life? 2 years ago, we started with group discussions around end-of-life care. We tried to help patients and families to recognize the most important values for them when time comes. Is it to be in the hospital to get the maximum care, or to be at home with family? Is it to be hooked up to wires and tubes, or to be comfortable and pain-free? We found out that people, among other things, that people not only liked talking about it, and a lot, they also liked talking about it with people outside of these group discussions. On average, each person spoke to 4 other people outside of the group. So from a group of 5 patients, 20 people were touched. And for an example, from 5 sessions, 100 people were touched. We called it the network effect. Approaching the second year, we wanted to see how we can use this network effect to a sustainable manner.
So we came up with the idea of incorporating patient champions into our group discussions. You might be thinking, who and what are patient champions? This is a term that we coined to define veterans of our program from our initial pilot study who willingly volunteered to facilitate a discussion of their own. We developed an online video module as a training mechanism to prepare them for their new role as discussion facilitators. We felt that their contributions to future discussions could be substantial. So these patient champions go out into the community, already experienced in discussing end-of-life care, and lead group discussions with novice participants. We've learned that sometimes our patients can be our best assets. So why is this necessary? If I could ask for a brief show of hands from the audience, I'm curious who here has had the conversation. Wow, you guys are impressive, and this group might be a little bit of an exception, but the data shows people are not having these discussions. While 9 out of 10 patients want to discuss end-of-life care, only 1 out of 10 have had the conversation with a healthcare provider. A lack of information and a lack of provider motivation exists around end-of-life care discussions. Given this data, our team had to think creatively. Who else was in our wheelhouse? Who had the ability to facilitate a discussion of this nature? While the involvement of the primary care physician was instrumental, we also saw this as a limitation. What if a patient couldn't easily access their PCP's office? What if he or she felt more comfortable having an initial discussion with family members and loved ones? Ultimately, we concluded that this discussion could happen anywhere. Could happen at your doctor's office, around your kitchen table, at your church. Anyone could facilitate. All we had to do was give them the means to do so.
But even if all of these conversations were happening in all these different places with all these different people, Due to time and geographical constraints, we realistically wouldn't be able to attend and facilitate every meeting. Our goal then was to come up with a way to offer this invaluable healthcare experience without requiring the presence of any trained medical professional. To reach the maximum number of patients, we decided to convert our live discussion module that we had developed during our pilot year into an interactive video presentation available online. So far, our website has over 4,000 views in 58 different countries worldwide, and we haven't even officially launched yet. What we've created is not just another educational video, but an interactive experience. In fact, the video itself is under 14 minutes long, but when paused for all of the prompted discussions, the experience generally lasts anywhere between an hour and an hour and a half. What we have continued to see during this second phase of our investigation is that people really want to talk about this. It's actually really difficult to get them to stop talking about it sometimes. Our next hurdle then was to come up with a way to ensure that this conversation could continue even in the absence of funding. To make a lasting impact, we started planting sustainability seeds, basically starting points that we hope can serve as a foundation as this grows into something much larger. The first of our seeds, of course, were our patient champions, who will continue this conversation indefinitely through their own networks. We are currently working with 3 of our patient champions from our pilot study. We also planted seeds in assisted living facilities who jumped at the opportunity to offer this invaluable experience that just so happens to be precisely geared toward the majority of the resident population. We also reached out to retired medical professionals. Who better to lead a discussion about future healthcare planning than someone with a lifetime of experience in healthcare? Lastly, we decided to plant seeds with these practicing physicians. In addition to printable copies of advanced medical directives available on our site, we also created a printable letter from the patient to their PCP expressing the patient's desire to have this future healthcare planning discussion. It is our hope that the physicians will see this letter and understand its value and recommend it to their other patients, but better yet, that providers will actually integrate the Take Control initiative into their practice. With all of these seeds that we've planted, we hope that just a couple might actually take root and become a permanent part of medical care, ensuring that everyone is at least offered the chance to have this conversation before it's too late.
So back to Anne's story. Once we introduced the hospice care, Anne and her daughter felt very relieved. They felt that there was a path, a plan to go through. It was painful to lose Anne, but inevitable, and most important, it was very peaceful. So what we ask from you today is actually to use our website. Schedule a conversation with friends or families or people in your network. Try to assign to see if there's one person who can be a champion and actually lead this conversation further to create this, to continue this network effect that we started. We think that this conversation is so important and it matters to us all. It's crucial for us to know what we want or we don't want towards the end of our life. Thank you so much.